When we talk about precision marketing in healthcare, what it really means putting the patient, caregiver, and provider at the core of every decision that we're making, and really thinking less about platform channel silos, but more about the entire health journey and where we can really intersect that journey to serve a message that's relevant, timely, and informational to the actual patient or caregiver. And so the way that we do this is not really by understanding the actual individual identities of that patient, but more so the signals that inform their patient journey. So that could be everything from what type of weather conditions are going to cause a condition flare-up. It could be what types of over-the-counter products they're purchasing to help kind of solve those symptoms as well, and how we can weave together those signals to make sure that we're intersecting the patient at the right moment with the right information to really solve a health need and outcome.
So how is CTV changing the way health brands connect with both patients and providers?
Right, so CTV really brings together the storytelling and scale of TV with the precision of digital. And we know that when we're thinking about health decisions, rarely are those decisions made alone with one individual. Oftentimes there's a caregiver in the household support system. So being able to really intersect that household moment with that precision of digital and audiences, it really helps us have a more impactful messaging. And really the importance of where and how we show up is underscored by our meaningful marketplaces approach, where we go and set one-to-one connections with all CTV publishers to have the most direct control and transparency into where that message is serving and what type of environment.
And speaking of environments, privacy constraints are tightening. So how are you balancing personalization with responsibility?
Right, so for us, privacy responsibility is not new. It's foundational to how we operate. It's how we decide the activation partners that are going to be part of our tech stack within our converged AI operating system. And it's really something that we continuously review with rigor. And we think this is a shared responsibility with us and our partners. And so all of our partners are OneTrust verified before we go to market, for example. And when we think about personalization, again, it's not about understanding that individual identity of a patient. It's more so understanding the signals that inform their journey, so that we can make sure that we are utilizing those signals and really reaching them when the message is most impactful.
And where are you seeing data and identity make the biggest impact on real health outcomes?
Really where we're seeing this is being able to tie a media exposure into an actual health outcome, like a doctor visitation or a new script. And an example of how we're able to tie in these different signals into health outcomes is through a new initiative at Havas, our health equity marketplace, where we're really understanding and trying to reach patients that are in underserved communities, whether that be a far distance from pharmacies or a healthcare provider. How can we use those signals and tie them together with health signals to get access to relevant information for these communities, drive an actual health outcome, and ultimately help serve these underserved populations?
And how is AI helping move healthcare marketing from targeting to a real, more informed decision making?
Right. So AI is not only part of our entire operating ecosystem, it's really part of the entire patient journey, and it's really about being able to, patients can go search for answers sooner, they are more empowered, they're more knowledgeable, and there's more opportunity for us to get this relevant information out there to patients. And then again, we can use these signals to help inform when it's going to be most relevant to provide this information. So that can be using signals before to be proactive instead of reactive, pre-diagnosis, pre-treatment, intersecting those key moments where a patient might be searching about their condition, looking for answers, and being able to really provide that helpful information then.